Hello, everybody. Welcome to Tuesday. Am I the only one who cares about this? Look down at your shins. Have you got any history of sock lines, that little indentation in your lower leg? Swelling in your lower leg happens to lots of people. I would bet that if you've been to an internal medicine clinic, you've had a problem with swelling in your legs. And most doctors and patients blow it off. They don't care. Tonight, we're going to talk about how this problem of swelling in your legs is caused by one of these four issues. And the best way to get your doctor to care is to help you see why it's super important. We're going to cover that tonight, and I expect you'll all be looking at your legs before this show is over. Welcome to the Dr. Boz Show. I've got a great show for you tonight. We are in the middle of our 21-day metabolic kick, and it is the last and final week where we take care of some really interesting cases, patients that or students that have come to the class and really have taught me how to best explain things, how to teach their classmates about improvements. And you'll notice the shows during the 21-day are rather clinical. They're very centered around patient cases. And I try to find ones that I think you will connect with. So check my work. If you've ever had swelling in your lower extremities, put a notice in the chat. If you're here live, most of you that are on live right now know what a thumb shin print is, which means you take that thumb, push really hard on your shin. You got to hold for at least 30 seconds. And then I want you to tell me if you have a shin thumbprint today. Because we're going to talk about why this is so important, how people blow it off when they shouldn't, and what's really happening in that case where that guy's got a big dent in his leg. Again, the case was awesome. It taught lots of students what we're looking at. But I thought I'd start with just a little anatomy lesson, that this is a picture of a vein, or actually of an artery. And I've used this diagram before, but when I'm teaching about this problem of edema, I like to start by saying, let me show you where the problem is. So we're going to zoom way into the tunnel, to the tube that carries your blood around. Arteries and veins have a similar anatomy, although a little bit different. And I want you to carefully notice the part that overlaps right there, where two skin cells are put together, have a nice seam, if you would, to make sure that there is no leaking. But I don't know if you notice the flaw in this, that there are some weak spots in where the body can leak fluid. When the cells bind together, there's backup plans after backup plans to try and not let fluid leak out where it's supposed to. But most folks with this swelling in their legs, they've got a problem. They have a metabolic, they have a systemic problem. It is not just fat found in their lower extremities. That when the pressure on the inside gets high too quick, too fast, or if the seal throughout your body isn't working right, that's what the fluid does. It pushes through that sealed skin layer. And here's what it looks like when you push it through and you look at the cells around there. I want you to notice that fluid is not inside the cells. This is fluid inside the cell, right in there. This is fluid in between the cells. And it's in that place where this stagnant, non-moving fluid is a sign of significant danger. It is one of the first things we teach med students in the internal medicine is to look at what's happening in the lower extremities. This gives you a telescope into the health of the patient. When I see this level of an indent in a patient, I mean, that is the outside of it, the depth that it is swollen in there, that didn't take a week or two. This is not fat. When patients say, I have swollen ankles, I'm getting fat. No, that's not how fat works. Fat does not leave an indent in your lower extremities. But the other things that patients blame on edema is also should not be written off as quickly and as without regard to what are the health problems underlying it. I do want you to take notice of the other thing that I always point out to med students, and that is you'll notice that this the shape of his calf is not normal. That shape has been changed because of the fourth problem on the list that we're going to go through today. So I'll save that, keep that in mind. But then also notice that you can't see any hair on his leg. So I'm sure all of you are looking at your legs to say, do I have hair on my legs? The hair on your legs is extra. Your body's not going to waste time doing that when these severe problems are happening. All right, so let's take a closer look at what is happening to this gentleman that started the 21-day course, and some miraculous things happened to him, but we're going to teach through his story. First of all, there's something called a venous or lymphatic outflow failure. What that means is as the blood flow delivers to your tissues and then returns to the heart, it flips around and goes, from the arteries, it flips around and then comes back through the veins. Most doctors and most med students think, well, the reason all that swelling is there is these little valves inside your vein collapse. And so they blame it on being overweight. They say, oh, the patient's obese, they've had this weight problem for a while, and that's why the swelling in their legs is happening. Now, I won't disregard that the obesity had nothing to do with it, but it's not the pathology. It's not the cause of the problem. These valves failing are not a good sign. That shouldn't happen. Once they fail, you're going to have a lifetime of struggling to keep the blood moving forward as efficiently, but your body has backup plans. Healthy people figure this out. We do restore this return of blood flow if we can fix the problems on this list. So the first thing doctors blame and patients sometimes blame is that just my circulation isn't working right. My blood supply isn't working right. And that is also true. But we look closer at a more global problem. The second problem, so venous failure is one thing. And I'll tell you, it's not that deadly. It is a problem that increases your risk of infection. It's in part why the shape of his leg was like this instead of having the hourglass of what the muscles should look like. But I also show that when I worry about somebody's lower extremities, the first organ that comes to mind is heart failure, cardiac failure. And you may have heard the word cardiac failure in a kind of a brush off moment. When I hear the word heart failure, cardiac failure, the first thing I think about is the heart strong enough to push that blood supply throughout the body? This is going to be related on how much mass is the heart pumping through. And then if you saw last week, how much pressure difference is it when you pump blood forward and when you relax? As you squeeze the heart, that's your lub in the heart, and your heart goes lub dub, lub dub, lub dub. When the lub happens and you push the blood forward, what is the pressure? That's the high number of your blood pressure. And when the dub happens, when it relaxes and the blood fills into the heart, getting ready for the next beat, what's the difference between those two? Those give it's called a pulse pressure, but it's also a sign that if you go to last week's really high blood pressure story, that pulse pressure was getting more and more narrow, meaning you pushed really hard to get the blood to go forward, and then you relaxed just a little bit, and then you push really hard to get the blood to go forward, and you relax a little bit. And that is super hard on that heart muscle. So cardiac failure or heart failure, the first thing I think about is, has the blood pressure been high for too long? Is that muscle fatigued? And the second thing I think about is the rhythm of the heart normal? Are they popping in and out of atrial fibrillation or some other reason why the pump of lub-dub is not happening? It's doing a quiver, and that's going to be really taxing on that heart. When that happens, the first thing you'll see is fluid stuck below the knee, fluid stuck in the ankle. And again, if you can push on it for 30 seconds and leave an indent, that's not fat. This is what we're talking about tonight. This is what I want you to try and help your doctor care about. All right, the third one that's on the list is something that should be talked about in every one of my lectures, which would be obstructive sleep apnea. Obstructive sleep apnea is when you collapse your throat at night and you stop breathing, often related to the size of the neck. And a large neck is the biggest risk factor. That often goes hand in hand with folks that put on too much weight. But the more important problem is that the hypoxia, or the low oxygen happening every night when you stop breathing, changes that heart failure. It puts such pressure on that cardiac output that the obstructive sleep apnea and the swelling in the legs go hand in hand. I just want to make sure everybody's following here. Lymphatic outflow and venous failure, not good, not a good sign. There are systemic things going on in the body that are causing an increased risk in mortality. Cardiac failure, heart failure, pretty easy to see that one increases mortality, absolutely. Obstructive sleep apnea, also really high association with mortality when this goes untreated. But I would contend the easiest one that gets blown off is the next one. It's the one that made me write that thumbnail, which is, am I the only one who cares about this? And that is a metabolic failure. Metabolic failure is so much more subtle. And you'll see doctors brush right past it because it's complicated. I mean, it's not that venous outflow isn't complicated, but they're going to quickly blame, oh, it's on their obesity. It's because those veins have those valves collapsed. There's nothing we can do about that. Yes, there is. The second one is cardiac failure. Although that's not subtle. I've got him on blood pressure medicine. I gave him an antiarrhythmic. Maybe I even gave him a little diuretic. It doesn't fix the problem, but it's a really quick step in the list of checklists when you're at the doctor. And of course, obstructive sleep apnea, your doctor shouldn't skip that, but they'll say, oh, they're on CPAP, or I sent him to the pulmonologist. It's this one, metabolic failure, that takes lots of time in the doctor's office, lots of education. And in fairness, I contend the insurance doesn't give you, the doctor, much reimbursement for that education. So it's places like this on a YouTube channel that we're going to say, what do I mean by metabolic failure? And I would say that most people who have edema, who have that swelling in their legs, this is the cause. I mean, I hope it's not these. I hope it's metabolic failure because it's slow, subtle, and we can reverse it. You can learn on this channel how to reverse it. Let's go to do that. All right, we're going to go to here and go to the next one. All right, I've used this slide before, but I want to teach you what metabolic failure really looks like. In the class that we've been doing for the last weeks, we have all of our patients checking their blood sugar and their ketones. We are watching their insulin resistance. We are trying to reverse it inside this class. But here is what happened long before they met me. The word insulin resistant started when the body's message to get fuel, these little fellows here are glucose, to get fuel into the cell, it's going to take some messages from the body. That biggest message is from insulin. When we see metabolic failure, it is almost always because you can't get the fuel to the place where you need it. So the first thing that happens is we see glucose rise over time. That's how the insulin got so high. Now that blood sugar has been higher and higher, your body is doing everything possible to suppress that. And in this case, the longer that glucose and insulin mismatch happens, I don't know if you saw those little subtle spins, those were mitochondria going from healthy mitochondria to these damaged ones. I'll show you an up close of that in a second. As the insulin, oh yeah, up close, here it is right now. So when you look at this mitochondria, instead of that beautiful wavy line that would have been in a healthy one, you've got holes in there. When this mitochondria goes to burn fuel, you'll see the energy blip out of it. Your oxidative stress that people say, oh, take an antioxidant, fix the mitochondria. The mitochondria is where the problem is. The mitochondria is the one leaking out those protons and causing havoc inside the cells. And this is the subtle disaster that's happening when people have edema in their legs, when they have metabolic failure. So there's those mitochondria. That's going to shrink back down, and we're going to show you what's happening inside this patient. As those insulins, those are the hormones that tell the cells, hey, let the glucose into the cell. As those 5 insulins bind to those green receptors, in healthy people, you would need a set of 1. You would need 1 insulin and 1 insulin receptor. As they bound, you would see this straw that just went up there, this GLUT4 receptor, go to the cell surface. You'd probably even see this GLUT receptor go to the surface to let glucose in. So watch carefully, because you've got 5 of them binding and you got 1 straw to go to the cell lining. Now the glucose can slip in. They can say, I will feed you. I will not let you metabolically fail. But watch what happened there. As soon as one of those dissociated from that insulin receptor, the straw hid back down here in the cell again. And because that because that receptor is now off the cell lining, those glucose cannot get in. And who starves? These mitochondria. The mitochondria is saying, hey, you gave me like 5 little morsels of glucose. This metabolic failure that we talk about is the hidden danger of what happens in insulin resistance. That glucose cannot get into the cell, and your cells are starving on the inside. One of those cells is your heart cell, is your heart muscles. That deliverance of glucose, that deliverance of fuel is usually very dependent on these glucose binding to the receptors and letting the glucose in. In insulin resistance, it's taking way too much insulin to do it, and it's not delivering much glucose once that insulin is bound. Now, there's some other chemical things going on we're going to talk about in a minute. I want to point out that this is our case of the day, if you would. And what you can't see here, maybe you can see it, 244.4 is what he started the class at. I'm going to just point out again here, he did put a shin print right there. That's what he did a few minutes before he got on the scale. Again, his case taught us a lot. And spoiler alert, he went in 1 week. In 1 week, he went from here to here. We're going to show you how he did that in just a second. I am going to take a quick moment to talk about something that I've been putting off because I was busy getting ready this 21 day. But if you go to the Dr. Boz page and you go to Dr. Boz favorites, and then you scroll down to the favorites, that upper left-hand corner shows you Hack Your Health. Hack Your Health is a conference that's here in Tampa. It is going to be November 14th through the 16th. I get to speak, I think, on Sunday. And I want you to notice that we have, if you look at the prices, it gets a lot more expensive as time goes on. So if you have not been to a conference where you get to learn about health, you get to meet me, you get to meet a bunch of the coaches that we use in the Dr. Boz team. It is one of my favorite conferences that I've ever been to. I like the energy in it. I like what there's still science that's taught, but they just don't take themselves as serious. And I mean that in the nicest way. Like, you can go to a few conferences where I enjoy it, but when I ask patients or people that are interested in their own health to join us, they walk out saying, I didn't get anything out of that. This conference delivers on content that patients can relate to. One of my favorite places of this is the vendor location, where you go into the place where they teach about not only vendors, but they have all kinds of devices where you can help yourself. If there's one theme to this, the Dr. Boz channel, it is that we want you to figure this out yourself. I'm teaching you about edema like I would teach a med student, not because edema is not a sexy thing to talk about, but it should be something every patient advocates for if they have it. And what I see happening over and over again is the doctors are far too busy. They're connecting prescriptions to diagnoses. Insulin resistance is a tough one. It is difficult to get that to reverse, but it's not impossible. And if you're looking for other ways where you can hack your health, please consider coming to meet us in Tampa. It's also one of my favorite people that leads this. Just a great story of saying, I left the corporate world and went all in to say, how is it that we have our best health in the last 50 years of our life? And my friend Robin she's become a friend as I've gone to Hack Your Health over the years. And I really want her to succeed in Tampa. It's the first time they're not doing it in Austin. And I love it in Tampa. Maybe it's because of my backyard, but that's a little selfish. But honestly, I'm wishing her all the success, and I will be there to support her all 3 days, making it hopefully a great place that you can come hang out with us. All right, so we are taking questions about this case. So if you have questions about edema or any of these things we're covering, put them in the chat. My team is watching that, and they will put those questions over into a document, and we'll cover them together. One more final thing that I didn't say out loud is last week I was telling you that there are some beef liver tablets that I made that I love them. It's freeze-dried beef liver. If you have low iron, this is how you replace iron, but it expires at the end of the month, the end of this month. We only have like a few dozen of them left. We have a fire sale going on to say, if you have never taken beef liver, this is the time to get it. If you have an animal who's losing hair or probably malnourished from the dog food you've been treating, this is another place where you can never find it cheaper than what I just put on the website. So go over to bozmd.com and look at the sale that's happening there. All right, let's get back to our case, because I think you're going to hopefully learn a lot, but also see where my point is. All right, so again, this is our patient who in 1 week went from an indent that you could almost bury your thumb in to the next slide here. Oh, come on. What happened in his glucose. I'm going to go here because I think it's a little easier to see these numbers. So this is our patient or our student who entered the classroom. Again, class started on September 8th. So right here, September 8th. And it doesn't escape anybody else that was seeing this lesson that his blood sugars were between 200 and 250 when he started the class. Again, not healthy at all. He's there to learn and to get help. Notice that the ketone number here is about just above here. So there's 1. So his ketones were a little bit above 1 when he first started. He had started lowering his carbohydrates. And he showed up in class that we put a good stress of lowering those blood sugars. And here's where he rose the ketones. This is where he ate little fish for 3 days. I think he actually did it for 4 days. He started on Saturday, so 1 day earlier than the rest of the group. And then he kind of went back to his normal life. Again, much better blood sugars than he had when he entered the class. This is where they were at the entries. Now you've got him down to about 150. And then he started on a water fast. Now, this gentleman had tried a lot of things. You can look at those blood sugars and have judgment for him, but I will tell you, I've seen patient after patient whose blood sugars soar higher and higher, and they get more and more determined, desperate to say, how do I get this to go away? How do I stop this? This patient did such extreme things as to, he fasted. He fasted for 21 days. And at the end of those 21 days, his ketones were 0.7. He even dry fasted on the last 3 or 4 days. This is not what you should do for an edema. This is not what you do when you see swollen legs like he had. In fact, those 21 days of fasting had to be so difficult for that man to do. If you're going to suffer, if you're going to go without food for that long, please let it be in a time where you can get the returns of improving your metabolism. And I would contend that did not do that for this man. In fact, it probably hurt his metabolism. 21 days without food, and he had ketones of 0.7. That's crazy. Let me just remind you, let's go back to this one over here. 21 days, and his ketones never got higher than that red line at the bottom. No, that's awful. That's terrible. Let me show you another. As you look at his story, when he entered class, you saw actually right before class, he weighed 251 pounds. By a week into class, he's lost, almost 10 pounds, right around 8 pounds. And then he was, then I visited the classroom and I gave him some instructions, and he listened great. I mean, he really wants to get healthy. And what came off over the next several days was over another 10 pounds. So he had 22 pounds that he lost, which is equivalent to 10 liters of fluid. And you'll say, yeah, you went on the ketogenic diet and you lost a bunch of water weight. I hear this all the time. This man needed to lose more than just water weight. That water was caught in between the cells of his lower extremities. It had been there for a long time. It is stagnant water. It has not been flowing. It is not moving. When he pushes on it with his thumb, he can move it. But I mean, you're going to have to be in a lymphatic massage for hours to get all of that fluid to mobilize enough to reverse 10 liters of fluid in what was in the course of about 10 days. All right, so let's go look at a couple things. What happened to this man as he started on that journey, as he lowered those blood sugars? Again, they're not where we want them. He's on a path to better. But if we look at the crises that happen when you see that level of edema in somebody's legs, the first thing we did was we lowered his insulin. This will stop the kidneys from, by dropping the carbs to 0, you drop the insulin. And the kidneys didn't stop handling sodium, but they really dropped in how they were flushing sodium out relative to the insulin level. So let's go back to this slide here. We're going to use this picture because I think it's easier to see. So here's our insulin resistant patient. Notice that you've got all this glucose out here in the bloodstream. I know it's blue, but there was too much red on the slide. So that blue background is supposed to be his blood. Notice that you've also got 1, 2, 3, 4, 5 insulins waiting to bind to their receptors, because that's what it takes to get these little straws to go up to the cell lining. And we're going to show you what happened to in this patient. So he starts the ketogenic diet, and what happens is he took those glucose from 250 down to 150. And again, not perfect, but way better. Except when you drop the glucose in an insulin-resistant patient, then you drop the insulin. And what happens then? So now only 3 of his insulins are hanging out ready to bind to their receptors. And when they do that, well, his cells are insulin resistant. They're not going to move to the tune of 3 insulins. They need 5. They've needed 5 for a really long time. As by evidence look at that funny looking mitochondria. It's not the healthy kind. It's the one with the little indents and holes in it. So as he's sitting there waiting, his blood, his muscles throughout his body, his cells throughout his body are all saying, hey, I need some fuel. I need some fuel. And during that time, you can see the glucose trying to get in, but you can also see those mitochondria vibrating, sending a signal saying, we're in trouble, we're in trouble. And when this gentleman was, when he was fasting for those 21 days, those mitochondria, they didn't vibrate. They just shut down. His cells were so unhealthy that instead of doing something you're going to see in a minute, instead of replacing those mitochondria, they just shut down to needing one little morsel of energy to stay alive. That's called a metabolic collapse. And it made his swelling worse. It did damage to his metabolism. Despite him saying, if I just stop eating, I'm sure this is all an obesity problem. It's not an obesity problem. It's a metabolic problem, and you can see it in their legs. You can see it for years ahead of time in their legs. Push on that shin, thumbprint, hold it for 30 seconds. When you take your thumb away, if there's an indent, that's not fat. That's this problem we're talking about here. It's one of these 4 things. So the second thing that happened in our patient was his ketones showed up. And this also causes the body to have some more diuresis, to have some more flushing of fluid. The ketone presence does that. The third thing that happened to our patient was that his glycogen emptied. Here's just the math for those that care about this. 3 to 4 grams of water equals 1 gram of glycogen. So glycogen is a molecule of a bunch of stored glucose. So you've probably seen this slide before. In a healthy liver, you've got some glycogen in there. When the blood sugar dropped, when the insulin dropped, those glycogen reversed. They went from being a bunch of glycogen to a bunch of glucose. And now, again, that's why his glucose is still 150. It's sitting there saying, oh, you finally let me free. You finally unbound me from the glycogen storage. And glycogen is one of those molecules that really holds on to fluid in the liver and in the muscles. So as you unwind that and the glucose goes back into circulation, that's another reason that he lost 10 liters of fluid in that next week. But here is the other part that I have tried to teach students over the last week. As the glucose drops and as the ketones rise, you have less of that leaking from inside those blood vessels. And this is my favorite one. This is the part where we're going to end the slides on. This is what our patient did just an incredible job of, that he did not do when he did 21 days of fasting. He did that when he used his metabolic knowledge to drop those blood sugars and raise the ketone. And that's called mitophagy. Let's pick up where we left off. So here's that slide. I'm going to go over to this one because it looks a little better. Here's that slide where we've got 1, 2, 3 bound, 3 insulins bound into those receptors. That's not enough to raise those that straw to the edge, but it is that moment where over time that insulin is, those receptors are regressing. those mitochondria are sending signals that say, hey, I need some help. So that vibration that happened in the last slide, where those mitochondria saying, I'm about to implode and I'm going to be replaced by at least one, but usually two other mitochondria that are going to burn fuel. And I didn't show this in bigger form, but if you notice, those mitochondria they look like this. They're nice and big, and they have this beautiful folds in here. That's a healthy mitochondria, not imploded, not wasting fuel. And those mitochondria are like adding some youth to your cells. And the best part about it is those ketones got to arrive on scene, and they did not require those GLUT4 receptors to go up to the surface. They enter the cell, they are delivering fuel, and especially these new, young, beautifully replaced mitochondria can succeed at burning fuel for our patient. So not only did he get those massive improvements in his the weight loss, but the reduction in his blood sugars, and through that whole metabolic stress of the last 15 days, the best part for this patient is he has replaced a bunch of mitochondria. He's done mitophagy. And if you look at the fourth of those problems when people have swelling is that metabolic failure. But it's also the one where you at home with your own tools and the knowledge you learn on places like this, you can reverse it. And it is a much better plan than the heart failure meds or the diabetes meds or the blood pressure meds that you're going to end up on if you don't reverse that edema in your legs. All right, let's get to your questions tonight. I hope this connected with folks out there. Again, I am just going to say a big praise to all the students out there that have had, we are on a 72-hour fast. You notice I didn't check my blood sugar this morning because my kit is actually sitting next to my bed. I'm checking it every morning, my glucose and ketones, so that all the students get to see my numbers. And my kit is not sitting next to me now. So I've actually completed 72 hours fasting today, and I would expect my ketones to probably be 3, but I don't have a kit to check them right now. All right, let's get to your questions. All right, so we're going to start with Carrie, who says, are you saying there should be no indent, or it should disappear very quickly? How hard are you supposed to push? Oh, Carrie, that's a great question. So first of all, I'm going to pretend this is my leg. Here's my thumb. When you're looking at your thumbnail, there's a capillary fill to the thumbnail. You can kind of see through your fingernail, and it's pink. But if you push on it really hard, it turns white, it turns color. And so when I teach med students, I'm like, you have to push on your thumb hard enough that you blanch the color under your thumbnail, under your thumb fingernail. So as you push on that shin, you should push hard enough that you blanch the tip of that thumb. And then you need to do that for 30 seconds. You want to push right on the bone. You're trying to push against a hard substance. You're trying to push that fluid out of the way. So push on the shin bone, and yes, it should hurt, especially if there's quite a bit of fluid there. With the gentleman in the story today, unfortunately, pushing on his shin thumbprint, he pushed that in there, and that dent, that'll stay there for a couple of minutes before the fluid slowly leaks back into the space in between the cells. Again, cells should fit together like this. When they've got fluid in between them, they fit together like this. And the more fluid in between them, the higher the disease. Great question, Carrie. All right, let's go to the next one. Andy R says, some say cut way back on sodium for lipedema. Your thoughts? Yeah, if you look at lipedema, this is a disease of inflammation in the fat cells. Lymphedema is also a decreased flow of the lymph cells. Those are terms that are really similar in spelling, really similar in sound. I contend they are both metabolic disasters, metabolic problems in your that present in the body. That lipedema is like the hardening of those fat cells. So imagine the slides that we just talked about. In insulin resistance, those, as the blood sugars drop, or even as the insulin rises, and the amount of glucose that can get into that fat cell is just less and less. And so as it lives in this world of too low of fuel, by it, I mean the fat cell. It lives in this world of too low of fuel. It gets fibrotic. It gets hard. It's a consequence of constantly starving the fat cell because the insulin was too high. The insulin you need 5 Mr. Insulins to get one little straw to the top, and then as soon as it goes to 4 insulins, when the blood sugar drops, nothing can get in the cell. And that constant inflammatory mismatch between energy that's demanded and the cell that can't deliver it. And it's a little bit ironic because those fat cells are filled with the best energy. They're filled with fat, but they cannot access their own resource because the insulin is so high. When I look at lymphedema is that decreased flow of the stagnant fluid. The stagnant fluid is in between the cells, but there are other channels where the lymph system is supposed to help get fluid back to the abdominal cavity. When the pressure is so high, because of stories like this, because of his swollen legs, the lymph system can't work. It collapses and it becomes stagnant. Another danger. So cutting back on sodium, no, go on a ketogenic diet. I think the sodium you're going to need more of the week you're on the ketogenic diet because you're going to flush that into the urine. I disagree with that. So could old severe ankle injuries contribute to the cramping issues? Cramping issues when people have swelling in their lower extremities, 100% I give credit to the magnesium. Again, there's nothing like a classroom of 200 students asking you about a question that all of them have. So as you saw, over the last 12 days, this man has lost 10 liters of fluid. Where did the fluid go? He peed it out. His kidneys flushed it out. Along with that flush are the electrolytes that are in your body. And the number one cause of muscle cramping, especially in the lower legs, is you are low on magnesium. In fact, during the 72-hour fast that we ask our students to try and do, we give them assignments ahead of time saying, I want you to find a magnesium float spa. This is a professional place where you go and you float on top of the water because the water is so filled with magnesium. The salinity or the salt level in that water is so dense. It's much like the Dead Sea, where you float on the Dead Sea. And again, magnesium is being infused through your skin, which sounds a little woo-woo, but this is actually one of the elements that you can absorb through the skin. And that magnesium just returns to the patient's system immediately. Now, in the case like today, if I sent him to a magnesium float spa before he lost all this water weight, you would actually run the risk of increasing his tax on his heart, like worsening the heart failure, worsening the metabolic. Because as that magnesium goes in, it's going to get trapped in between those cells. It's going to get trapped in those lower extremities. Without replacing it, he's going to have muscle cramps. That muscle cramp in the legs are something you can feel. But the muscle cramps in the heart, the muscle cramps in a migraine, I mean, in your head, you're getting migraines, all are directly linked to that chronically low magnesium. So when I look at ankle injuries, can be a little bit of, they can have a history, they'll have some inflammation, but they compare nothing to what the hypomagnesium or the low magnesium does for those cramps. All right, next one. Kate D says, will the long fast increase the edema? Yeah, in his case especially. So one of the points I was trying to make in that slide deck was, so when he fasted for 21 days, his mitochondria did not get replaced. He didn't have fresh little mitochondria coming in and say, let me take over. You just made us fresh out of, we're fresh out of the womb. We're freshly created mitochondria. That's what mitophagy did. Those mitochondria said, we aren't going to make it. We need to be replaced. And they signal that mitophagy should be happening. You can predict that by how much his glucose went down and his ketones went up. When he did the 21-day fast, and he ended with a water fast, and his ketones at the end of all of that, 0.7. That is not mitophagy. That is a mess. That is him hurting those poor little mitochondria that are just trying to wave a little white flag. I give up. I don't know how to function. I can't help you. And you will worsen the edema in a case like that. So again, part of that, the fourth cause of that edema was metabolic failure. And the metabolic failure is reversed by replacing mitochondria, by stimulating the repair process in the human body. And that's what this gentleman just did. And he did it fantastically. I got to see him today in class. And again, his color, I don't know if you saw, let me see if I can show this slide again. The color of his legs are different, right? Here we go. Look at that. This is the color. I mean, I'm sure there's a light, a little different light on there, but the kind of grayness you see in this one, and more of a vigor and a pinkness you see in this one, that is not, that is real. Yes, I'm sure there's a little bit difference in the photo, but when you see this in real life, his vitality is better. His articulation of his words were better, all in 1 week. All right, let's go back to questions. All right, let's see. How long, if he stays the course, will it take him to turn this around? So it's a good question. Let's go back to his numbers because it'll help you see the trajectory he's on. And go here and go here. So here are his blood sugars, right? So the brown is the blood sugars, and the blue is the ketones. So when his blood sugars, here's the blood sugar of 150, when they are still, here's 100, right? And so our goal is to get those morning fasting blood sugars below 100. How long is that going to take him? It depends on his insulin resistance. I mean, I've seen cases like this. I would encourage him to use some of the medications that a doctor could prescribe for him. This is not medical advice, but if it was me who had these kind of numbers, the longer those blood sugars are elevated like that, the more damage he's doing to many organs. I want him to get there and be off the medications long term, and I think that's his goal as well. But his heart is under significant tax when he hangs out with blood sugars this high. So the timeline for him, I'll tell you this, if you have asked me this a year ago, I would say it's going to take 2.5 years to get his real metabolism back to the best of his health. But I bet if a GLP-1 GIP is used in a case like this, there's a really good chance of it being much better in that 6 to 9 months range. It just speeds up the recovery of reversing insulin resistance. Again, there's some caveats to that we're learning about in class, that you can't find those results if you are not in an advanced ketogenic state. The drug alone isn't what does that. You really do need to have your metabolism spun, working. And he's doing a great job, but he's been at this, he's been struggling for a while. All right, so Betty says, what would cause a shin print to be significantly deeper in one leg than the other? First of all, old injuries will do that. The injuries of this gentleman actually broke both of his legs, so he has that additional reasons why the swelling is in his legs. But the other part is, you remember that vein that I showed you with the collapsed, here, I'll show you here. When I look at this, there's a whole column of blood vessels, of veins. If this is your vein here, and the column runs all the way down your legs, every time one of these little valves collapses, it affects the one below it. So if we take out this valve, now the column of fluid on this valve is twice as much. And then you take out it's a domino effect, and then it takes that out again, and then it's another one. So when these valves start to collapse, you will find that the return blood flow is very difficult. So it is not uncommon for one leg to have collapsed a lot more of those valves than the other. Sometimes it's a blood clot, and I mean a superficial one, not the kind that goes to your pulmonary system or your brain. But even a superficial blood clot can start the increased pressure in that. In fact, one of the tasks that I gave to this student was, instead of trying to massage out all of this fluid, which is what a lymphatic massage will do, is they really slow push on those legs to try and move that fluid along. One of the things that we gave him an assignment to do was to go get in a swimming pool. And as you look at the pressure of pushing on that fluid and returning the fluid back into the circulatory system, you need a critical mass. So it's usually a swimming pool that you get into it. And I want you in, from the armpits down, and it's all pushing that pressure to return fluid back into the circulation. And you can experience this yourself. You go into a swimming pool and about 10 to 15 minutes later, you got to go to the bathroom. Why is that? Because the pressure put on by the mass of water pushes on that stagnant fluid for all of us, pushes on the veins that might not have had that kind of a squeeze in a while. And as you squeeze on those veins, it increases the filtration at the kidney and puts the extra fluid into the bladder. So yeah, that's one of the ways that we got that. He didn't do that until the last 2 or 3 days though. He lost most of the fluid because he metabolically improved his body, his mitochondria. All right, last question I think is from Aloha. Oh, I love him. Maybe it's a her. I actually have not met them. What are your thoughts on the vibration plates? Can those help with flushing of this fluid? The vibration plates are not bad. I've seen folks move fluid and, oh, there's a couple more questions, sorry. Move fluids that, with just the vibration of that. I would tell you it's not as powerful as the metabolic improvement. I still vote for the pool. I think that constant pressure is, that 15 minutes of pressure on his whole body is still really probably superior way to get the mobilization of the fluid. The vibration plates aren't nothing. I do think there's a difference between some of the frequencies, so just ask ChatGPT about that. I won't go on record on saying that just yet. Okay, last question. I lied. Here's the last question. So what effect does that lymphatic massage or exercise have on edema, swelling in the lower leg and extremities? I noticed I'm making progress skimming the bay wings, diet or lymphatic drainage. Again, the movement so that lymphatic massage or exercise does change, that moves the fluid in the lymph system. And it's real. That's how most of us don't have fluid in our legs, is because we pump and relax our muscles, and the pressure on the inside isn't there. So we're moving that lymph system by being alive and walking around and relaxing and contracting your legs as you go up the steps or walk down the street. Doing that manually, which is what a lymphatic massage does, again, it does reverse the edema. It does improve it short term, and especially for people who've just really had a stagnant edema, those lymphatic massages have been pretty helpful for patients. I still think you can't reverse the problem without replacing the mitochondria. That's really the key. All right, folks, again, a good send-off and prayer for all those folks that are finishing up the 21-day metabolic kick. I might irritate some folks when I say this is the best class we've ever had. I've really just found the progress, and not everybody's brand new, so there's people with some real struggles that have made amazing breakthroughs, and I love it. I love teaching. I love watching the students get better. I love hearing, I can't make a ketone, and then watching the dashboards be filled with ketones and all the students. All right, signing off, everybody. Good to see you, and we'll see you again next week.